So why are you here today? First aid, it's actually super easy, okay? Everything I'm gonna tell you today, you're like, oh yeah, that makes sense. And it's gonna seem totally intuitive. But if you can master it, every single thing today, you can walk out of here and be able to save a life after today, which is cool. That's why you're here today, right? You're in med school because you want to save lives. Before we get to any of these topics, rule number one is safety first, okay? If you are engaging in first aid and you get hurt or you get exposed to a body substance fluid that's contaminated, we have failed, okay? So rule number one is safety first for yourself going forward. So this comes down to something called situational awareness. Without turning around, do you know who's sitting right behind you? All right. The people on the edges know because they're against the wall. Good job. All right. Without stepping outside this room, do you know where your closest AED is? It's actually right behind us by the bathrooms. Do you know where the closest exit is? Bright green signs, so perfect, all right? So situational awareness is kind of being aware of your surroundings. If something bad were to happen, how do you get out of that situation? And then just being aware of, like, you know, that person over there in the corner looks like they're getting agitated or aggressive. Not really, not you. Or, you know, if you're driving and you see an accident on the road, making sure that you stop traffic before you engage. So it's just being aware of your surroundings and mitigating possible dangers. So where might you find some sort of accident that you can participate in and help? So traffic accidents. This happened to me a couple of months ago. I was driving down the lodge and a motorcycle had spun out right in front of me, and I got out and I helped. I keep a first aid kit in my car. I had some gloves, I had some gauze, I was ready to go. But before I did that, I used my car to block the accident so I wouldn't get hit. The last thing you want, there have been several tragic accidents recently where a doctor has gotten out to help and they got hit and killed. Okay, so before you engage, fire trucks, they do this naturally. I don't know if you ever noticed this, but fire trucks, they purposely block accidents downstream, and that's kind of their goal. So if you ever are tempted to get out, use your vehicle to block or come up with another plan to stop traffic before you engage. Make sense? Cool. Chemicals, you gotta put the fire out before you treat the burn patient. Otherwise you will be burned, the house will be burned, there'll be inhalation issues. So address the issue first. Power tools, we see a lot of chainsaw accidents. Snow blowers, even if they're turned off, they can kick back, they mangle hands like nobody's business, so never put your hand in a snow blower. But if someone got hurt by a power tool, turn it off before you engage, okay? We do this class at Focus Hope. It's actually a big factory. Turn the machines off, turn the power to the whole system off before you engage. Dangerous animals, lions, tigers, and bears, oh my, no. But if someone has a normally docile, super nice, sweet dog, but they are injured, that dog may act erratically because they know something is wrong, and now some stranger is coming up and touching their injured owner. So, you know, a regular, nice, kind dog can become a danger and a possible threat. And then active shooters. In this day and age, we have to discuss active shooters. The University of Houston has a great course they teach, ADD, avoid, deny, defend. Avoid means get the heck out of there as fast as you can, run in the opposite direction. Deny, if you can't leave the situation, deny that you're there. Lock and barricade the doors, turn off the lights, hide under a desk. Number 3 is defend. There's no such thing as dirty fighting when it comes down to your life. You do what you need to do to defend yourself and those around you. It's a whole course. I don't know if you've heard of it or done it before, but there's tons of YouTube videos. I'm not going to go too in depth, but active shooters. So the scene is safe. What do we need to do next? You got to get help on the way. Sometimes that means a 911 call. Sometimes it's a minor injury and you have to call for a friend or a parent to come and pick someone up. But you want to get help on the way. Now, if this young man right here all of a sudden has a cardiac arrest in front of us and I yell to the room, quick, call 911. And I go over and I start helping him. Which of you guys actually did it? I thought you did. Oh, wait, no. I thought, oh, wait. If you're in a situation with a crowd, they've seen many, many, many times where everyone presumes someone else did it. So what you need to do, you call 911. And she nodded back at me. He did too. Great, I got two people. Great. All right? So you need to make eye contact. You need to get that verbal or nonverbal cue that someone is doing it. Otherwise, it did not happen. If you're alone, dial 911, put them on speaker, get your hands back, and you can keep going. Ask permission. So consent is necessary for first aid. As physicians, someday this is something that just becomes implied because someone signed in to the hospital or clinic and gave consent ahead of time. But in first aid situation, you introduce yourself. Hi, my name is Chris. I have first aid training. May I help you? If it is a competent adult, can they refuse? Yeah, absolutely. What happens if you don't ask consent or they refuse and you continue to help them? What is that?
That's a lawsuit.
That's assault and battery, my friend. You got it. Okay? So you need consent before you're allowed to touch a person. Now there's some caveats to that, right? When do you think it's okay to go ahead and help someone who has not verbally expressed they want your help? What if they're not conscious? What if they are markedly confused? They can't even tell you their name or the time of day. Okay, maybe they had a stroke and they have expressive aphasia and they can't talk. Maybe they're profoundly hypoglycemic and they're completely confused and they can't tell you anything. If someone is confused or unconscious, there's implied consent that they would like some help. Okay, so go for it. What if it's a kid? Kids can't officially give consent, only their parents can. So if you find a lone 12-year-old that's injured, it's implied consent that you can help them. Now, if they're 17 years, 5 months, and 3 days, and they're refusing, like, I'm not going to have you get into an argument with a teenager. But if it's a kid and they're alone, you can help them. If their parent arrives, the parent has the right to refuse your care. That make sense? All right, fair enough. Now, if you go through this process and you introduce yourself and you get consent, you start helping them, you have just engaged in a contract with that person to stay until more advanced help arrives. Now, that might be an ambulance and an EMT. That might be that their parent arrives. That might be their friend arrives and can take them to the hospital. But if you engage, you have committed to helping them until you get them to the next step. Makes sense, right? If you don't, that's also a lawsuit. That's called abandonment, okay? Now, all of these things, there's a whole constitution of laws called the Good Samaritan laws. These are the laws that protect you, okay? Every bystander and every person that's applying. Now, physicians, when you get to that stage, as long as you are acting within the things that you know, you are covered. So an ophthalmologist doing a needle crike on a pediatric patient, they're not trained in that, okay? So you have to kind of operate with under, and that's totally me. I totally forgot to turn off sorry about that, if you guys hear that binging. Turn off your phones. So as long as you're operating kind of within your frame, you're covered. This covers for CPR. They amended the laws in Michigan to cover opiate use disorders so that if someone who has an overdose of an opiate, oftentimes what they were finding is the people around them were afraid to call 911 because they thought they'd get busted for having drugs. Okay, so they changed the laws so that that shall not happen, and that has ended up saving lives. Every state is different. So when you graduate from here and you move back home, or you graduate from here and you match across the country, you need to know what the laws are in that state, okay? But something to keep in mind. Privacy. In today's day and age, if someone were to have an incident on the sidewalk, almost immediately you will see 12 phones up and recording and being live FaceTimed, okay? So I request that as part of a first aid responder, step number one is crowd control, having people back up. I have found if I say with an authoritative voice, put your phones away, that's not okay, people do it, okay? So if you can stand to protect the person's privacy, it's in their benefit. The other thing is you might hear some information that they don't want shared with everybody. The young lady may have passed out because she's pregnant. The person who's cut and bleeding may tell you that they have HIV just to help protect yourself. That's between you, the person, and the higher level of care if EMTs arrive, but it's not for necessarily their friend, their family, your friend, your family, etc. Make sense? All right. Again, very common sense, but needs to be said. Number 2, so we have kept everything safe. You have consent, now we're going to engage. Who at home has a nice first aid kit? Ooh, okay, you guys know what you need to request from your friends and family for your birthdays. Who here, we know where this one AED is. Who here knows where the AED is at their local grocery store? At the local mall that they go to? All right, you guys got homework, okay? You need to know at the places that you frequent, that you go to on a regular basis, where the AEDs are, okay? Because I guarantee, I know the first time that I learned CPR, I was just waiting for someone to have an arrest in front of me. I was so excited. ER doc, sorry, okay? But if that ever does happen to you, you're gonna wanna feel prepared. You're gonna wanna be able to say, go get the AED. It's on the second floor, right across from 240, okay? So these are the things that you wanna know. All right, so I presume none of you guys have full mask, well, you have masks, but no gloves or anything in your pockets right now. But you might be out and about town and you might have a plastic bag or a chip bag that can protect your hands. A couple of layers of cloth or clothing between you and the patient can protect your hands. Who here has sneezed before? Yes, okay. Someone with a bloody nose who sneezes, just picture a cloud of particulate, okay? If you are treating someone that has a bleeding emergency, if you do not wear glasses, put a pair of sunglasses on. That'll protect your eyes, okay? Just some tips, some ideas. Everybody grab your gloves, and I need a pair of gloves up here as well. I'll take some mediums, that'll work. So everyone put your gloves on. Thank you, Stephanie. All right, so many times I'll be sitting in the trauma bay and the trauma service will have a 3rd or 4th year medical student on, and they're kind of sitting in the background and they've got their gloves on, they're ready, they want to get in and do something, and I'll see them kind of fix their hair. Or I saw one guy with a beard and he was just sitting there with gloves on doing this. I have no idea what he had touched with his gloves before he touched his face. So I want you from here till the end of time to picture there is dog poop all over these gloves. Gross! There's probably some stuff that might be grosser on there, okay? So I want you to, these belong to the patient, they do not belong to you, okay? So when you go to get them off, if you go like this to get these gloves off, did you just contaminate your entire arm? Super gross, right? So how do you get these off without contaminating yourself? Number 1, you're gonna pinch your palm, okay? So dirty is touching dirty. You're gonna wiggle that hand inside out and invert that glove. You can do it now or you can do it all at the same time afterwards. After, I'm gonna roll this up in one hand so it's kind of contained. Clean hand goes under the edge of the clean glove. I'm gonna invert this one. Now the whole thing is contained, no big deal, safe to throw away in biohazard or garbage. Cool? All right, you have officially learned your first thing. Anytime you take on or off gloves, you gotta wash your hands afterwards. You guys are really good at this after the pandemic. Happy birthday twice, get under the nails. I can tell you that me personally, if you rotate in my emergency department, I totally look at your nails. If you got dirty nails, I go make you wash your hands. You guys should have manicure sets at home and be nice and good with your cuticles. I didn't do it today, you guys can attest, but clean hands is the must. Shock. This is a medical term, doesn't mean that you're shocked. Who has ever played this game before? You guys remember Operation Fun Times? Shock is a technical term, and you'll spend much of your medical careers learning how to identify and treat this in its many forms. But it's basically the oxygen is not getting to the tissues, okay? There's 4 main categories of how this happens. But shock is in that spiral to organ death and patient death, okay? So you want to be able to recognize this because this is a big deal. This means oxygen's not perfusing. So a pump, a pipe, a pool, a plug, you will spend other rotations learning that. It's just a fun way to remember it. But what causes this? Hundreds of different things, okay? So a pump is a cardiac failure. Your heart stops beating appropriately. A pipe is distributive shock. All of your normal sized vessels double in size and all of a sudden the pipes are too big to actually move any of that fluid. That's anaphylaxis, sepsis, neurogenic shock. Pool, you lost all of your volume. You either cut your artery and half your blood volume's on the floor, or diarrheal illnesses are the leading cause of childhood death worldwide. Dehydration can cause this as well. Or obstructive shock, which is a plug, a big PE, cardiac tamponade, attention pneumothorax. You'll get to that later. Okay, so many causes, but luckily, shock all pretty much looks the same. Okay, so if it all looks the same and it's all treated the same, you can worry about that stuff later. Okay, as a first responder, you just need to know how to recognize it. What does it look like? Pretty easy. People don't look good. Okay, so they'll get pale or ashen. Sweating is never a good sign. Okay, if you see someone in a cold sweat, that's a bad indicator. If they get restless, confused, may say that they don't feel well, they're nauseated, they feel lightheaded, those are all bad signs. Okay, this is something that a lay person looking across the room can just look at someone and say, oh, they don't look good. Okay, that's what you're looking for. You guys have not yet done your phlebotomy class yet, I believe. I believe next year you're gonna learn how to take blood from each other. Vasovagal syndrome, okay, kind of passing out, looks similar to this. At least one of you guys is gonna almost go down or will go down, okay? So if you see someone that starts looking like this, we wanna treat for shock. They're not in a life-threatening version, they're in the fake version, but it's all the same. You're gonna lay them down, you're gonna keep them warm, and don't call 911 during your labs, but at least getting something under their feet will help get some venous return back. And keeping them warm is really important for shock-like state. In your little Ziploc baggies, we'll have those foil blankets that they use for marathons. It's a good thing to put over someone, okay? Pretty easy so far. They used to teach to raise the legs 12 inches. That gives a transient response. If it's someone who had a traumatic injury, you don't want to be moving the legs, so they kind of are adjusting that, but no harm, no foul if you lift the legs up as well.
That part's not going by itself.
You can't go back.
I would have been worried about it. Oh, man.
What happened?
I think something stung me. I think it was a bee.
What?
Yeah,
That must
man.
hurt like a son of a gun. Jesus.
It does, and it's really bad because when I was a kid, I got stung, and I had a terrible reaction. My mom said if it ever happens again, I could die.
Actually? All right, come on. Let's go sit down right here. Hold on.
Thanks, man.
Yeah, no problem. No problem. You good?
Yeah, it really hurts.
How you feeling? What's wrong?
I don't know, man. Starting to get kind of itchy all over, and
Actually?
yeah, a little lightheaded, and it's really tightening up in my throat. I don't know.
Through your throat?
I think
You-
I'm having a
Do
reaction.
you have anything on you?
Yeah, actually, I have this EpiPen my mom gave
Oh,
me
shoot,
a long time ago. It's been so long, I forgot to use it. You
No,
mind
I
helping
got
me
you.
out?
Instructions are right here.
Thanks,
all right, so
man.
you gotta take this blue cap off, all right? And I'm gonna put this on the outside of your thigh for 10 seconds, okay?
Okay,
All right, here we go.
I'm just thinking.
Ready? 1, 2, 3. 1, 1,000. 2, 1,000. 3, 1,000. 4, 1,000. 5, 1,000. 6, 1,000. 7, 1,000. 8, 1,000. 9, 1,000. 10, 1,000. All right, just gotta rub your leg for you, all right? Here, rub your leg. All right, while you're doing that, I'm gonna call 911, all right? One sec.
Thanks, man.
Yeah, no problem. Hi, I need to report an allergic reaction. Yeah, we're here on Russell and Gratiot. Yeah, I administer the EpiPen. I'll keep you on the line, all right? Okay, thank you. You should be on their way, all right?
Thanks a lot.
Yeah, no problem. You're sweating a lot.
Yes.
Allergic reactions are quite common, and they can be caused by common foods such as egg, peanut, or chocolate. Also, medications can cause allergic reaction as well as insect bites. The important point of any allergic reaction is to immediately distinguish if it is a mild allergic reaction versus a severe allergic reaction. For a mild allergic reaction, the symptoms can be runny nose, itching of the skin, as well as hives. In that situation, it will suffice to treat that with Benadryl. However, what's critical is recognize a severe allergic reaction, which is signs of difficulty breathing, swelling of the tongue or throat, as well as dizziness or weakness, which can be signs of shock. In that instance, the most important critical treatment is the use of the EpiPen. We will go over the step-by-step instructions of how to use the EpiPen in the next segment. Thank you.
First is if you get this wrong and you have a thumb over an end, but you have the wrong end, you could deliver the medication into your thumb, which could cause some issues for you, but it will cause many more issues for the patient who will not be able to get their medication delivered. So we recommend holding this with a grip and then over your thumb, so your thumb is not over one end or the other. To activate, you're going to take off the blue cap, and then you're going to, with force, the side of your thigh. You'll hear a click. You'll count then 1 1,000, 2 1,000, 3 1,000 to 10 counts. And afterwards, you should see that this end has deployed. You'll rub the thigh. You'll call 911 if you have not yet already. And this is a practice device. There is no epinephrine in this. To reload for your partners, just squeeze, put back, and you should be good. One other note about EpiPens. These can only go through one layer of clothing. So if it's winter and you have 3 sets of long johns and ski pants on, it's not going to work. You have to shimmy off some of those layers and go through one layer. Thank you very much. If you have any questions, check out the back of the EpiPen or ask for more questions. Thank you. Cold emergencies. Some of this ventures on more wilderness medicine, but things that to keep in mind, especially for those of you who are not from Michigan originally. So hypothermia is when the entire core body temperature drops. Frostbite is when extremities freeze. Okay, so a little bit different process. You can have a patient with hypothermia that doesn't have frostbite and vice versa. So what does hypothermia look like? In some ways, it looks like someone who is clinically intoxicated with alcohol, okay? They'll be a little confused. They might be stumbling. They may be discoordinated and have difficulty speaking, okay? You may have shivering, or shivering can go away when you get too cold, actually. So that may go away, and they may have, again, stiff muscles and discoordinated. How would you treat someone with hypothermia? Easy peasy, get them out of the cold, get them out of wet clothing and put on some blankets. Okay, pretty easy stuff. The wet clothing piece is actually one of the biggest ones. Okay, so that in and of itself is one of the big things here, especially on rainy 40-degree days when we get patients that come in, getting them undressed is one of the first things we need to do. Frostbite, when these tissues freeze, the tissues are going to become kind of waxy and firm. They're going to be insensate. They're not going to usually feel them. And there's a couple of stages of this. Usually the first 24 hours, they're frozen, and then as they thaw, they'll get blistery and shed skin and get swollen. Again, you want to get them out of the cold. If extremity is frostbite or frostbit, you want to put it in warm water, not hot, but warm water to start thawing back out. You want to make sure, you know, when people have cold hands, you always want to do this, right? If there is a bit that's actually frozen, you'll get shear forces and actually damage the tissue. So you do not want to handle these harshly, very, very delicately. And then after they're warmed up, you'll bandage. If it's a hand, you usually want to kind of get some gauze in between all the fingers so they don't touch, because again, they're going to swell. And then I make oven mitts out of them. Just wrap them loosely and keep them covered, okay? Now there's a caveat to this, again, for the wilderness people out there. If you were, 6 miles down a trail you got stuck in and you can't make it back, if you already have frostbite but you're not going to be in a warm place for a while, don't thaw and then let it refreeze. That's actually worse. Okay, think of a steak that goes in the freezer, thaws, and then gets frozen again. You ruin it. Same thing happens with tissue. If it freezes, thaws, and refreezes, it's much more significant damage. Okay, so for those hikers out there. So if this picture, let's say it's 15 degrees and snowing, what is he at risk for more? Frostbite or hypothermia as he's shoveling? Frostbite, yeah, he doesn't have any gloves on right there. And it was probably about 5 years ago, we had a very cold winter, and I had one patient, he walked a quarter mile to KFC and then walked home without gloves, and he had complete frostbite of both hands just in that 15 minutes outside. It didn't take very long. Now this woman, it's 40 degrees and raining. She is not dressed she doesn't have any rain gear on. She's not wearing thick clothes. The time that we see hypothermia the most is spring and fall when it rains. Because especially in the spring, 40 degrees feels like a summer day, right? Like everyone's excited to get outside and we might not dress appropriately. That's when you're gonna see this the most.
Melvin, it's too hot out here. What you doing?
I want to finish up so we won't be late for the ball game. Oh, Charlie horse. Oh.
Heat emergencies include heat cramps, heat exhaustion, and heat stroke. Heat cramps are cramping in the muscles. Heat exhaustion also includes nausea, vomiting, dizziness, and heavy sweating. Heat stroke, sweating may have stopped, and they will be confused and may have seizures or faint. For all heat emergencies, remember to remove them from the heat, cool them by pouring cold water over them, and remember to remove clothing. For heat exhaustion or heat stroke, call 911.
I got you some water. You okay? Melvin, what day is it? Ooh, you're hot. What day is it, Melvin? Where are we going? What's going on today? Where are we going, Melvin? Where are we going, Melvin? Oh my goodness, you're too hot. You're too hot. Yes. My husband, he was out here cutting grass. Yes. 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 123 45 Main Street.
All right, so like Dr. Elrod said, there's kind of 3 different stages of heat cramps or heat emergencies. So you start with heat cramps. Okay, everyone's kind of been there, out on a hot day, not drinking enough. You may get dehydrated and a little overheated. Not a big deal. That's usually easy to kind of correct. Heat exhaustion, if you have people that start getting nausea and vomiting, that's a bigger deal, and that can quickly switch over to heat stroke. Heat stroke is absolutely life-threatening, and every summer or so you'll hear about football camps or even professional football players that got into this emergency and died from heat stroke. There's 2 kind of groups that we see that die from heat emergencies. The one are the young, healthy athletes practicing on very hot days. The reason that they trick their coaches is that young, healthy, physiologic people can still sweat long beyond where they're in danger. And so they're like, oh, they're still sweating, they're still okay, when really their core body temperature is at 107 and they're losing the ability to cool themselves, okay? The other group that we see that have trouble with heat emergencies are elderly people who live in apartments without air conditioning in the summer. They also, because of their medications, they're not able to regulate their body temperature well and can get into trouble, okay? So the treatment is very easy, right? Like I said with hypothermia, wet clothing sucks the heat out of you. So get them wet, pour some water over them. Evaporative heat loss is one of the best things you can do. So if you get them wet and then fan them, that helps get the heat off of them pretty quickly. Submersion in water is actually one of the best, but very few people have a kiddie pool at the ready. Some of the like Burning Man and other big festivals, the medics at those, they actually set up kiddie pools and get ready because this is something that you see a lot, especially with people who are doing MDMA in addition to the desert. If you can lay them down, that helps. Cool packs in the junctional regions, so the neck, the groin, the armpits also helps. And then have them drink if they still can drink, okay? Yes, working festivals and mass events is another part of emergency medicine, and concerts is one venue of that. Now this one is near and dear to my heart, as I'm a trained ski patroller for the last 20 years. I'm an emergency medicine physician for a while. I did not learn about this until I was at a conference 2 to 3 years ago, presenting First Aid First, and I was like, how can I, as a trained first responder and emergency doc, not know what drowning looks like? Okay, so here today we are training 75 people to be eyes, okay, so you can know what drowning looks like.
In a minute, I'm going to drown in this pool, surrounded by friends and relatives. That's because Dad thinks Mom is watching me, and Mom thinks Dad is. But actually, nobody is watching me. And you rarely make a sound when you're struggling.
Don't assume someone else is watching. Become a water watchdog at abbyshope.org.
Now it's still animated, right? So you guys want to see what an actual person who's drowning looks like? All right, we're not going to let him drown, don't worry. We've got a lifeguard video.
Hey guys, it's Lifeguard Rescue here with my top 5 favorite lifeguard rescue videos. Coming in at number 5 is Lifeguard Rescue number 1, the first video I ever posted to this channel. It is a fantastic rescue, and I was amazed at how many people had trouble spotting the girl who was drowning in this video. This lifeguard does an excellent job at scanning his water and recognizing the girl who is drowning. He also makes a picture-perfect rescue.
So the thing that I think is common, that look of the arms going flat down in the vertical body is 2 things that I had never quite seen before, and the fact that you're not going to hear anything. All right, so you guys can look this up later and watch all of them. All right, but the main thing, reach, throw, and don't go, or reach, throw, row, and don't go. Unless you are a trained lifeguard who is currently up to date, because they have to hold a weight over their head for 10 minutes, it's for real. You will hear almost every year of someone who went in to help a drowning victim and they ended up being the ones who drowned, okay? So if you are not a Trine lifeguard, do not do it. Coolers, if you're at the beach, because just picture Belle Isle Beach is opening up. If you're at the beach and someone has a cooler, just dump it over and throw the cooler. Coolers are super buoyant, right? Or a rope or a stick or something. Make sense? All right. Look at all you trained drowning people. All right. That's a picture of Belle Isle. All right, we're gonna skip ahead. I know I'm like overloading your brains with topics, but all of this is available online. We'll have the recording. You can go back and look. It's just to bring up things that maybe you have not thought of before, just so you have some experience. Sound good? So low blood sugar. Who here knows someone in their life who is diabetic? Right? So this is a pervasive phenomenon. People who are diabetic on medications, those medications are designed to drop their blood sugar. And sometimes they work a little bit too good if they haven't had something to eat or drink or are exercising too much. Okay, so low blood sugar can be a life-threatening emergency, so knowing what it looks like. Who here has ever been hangry? Yes, all right. So this is hangry times 10. Okay, so people might get shaky, sweaty, dizzy. They again may have some difficulty speaking. They may say they're hungry or thirsty. And they may, some people, they know their family member is getting low blood sugar because they just get cranky. Okay, so that might be something as well. So what's the treatment? If someone has low blood sugar, what do you want to do? Give them sugar, thank you. All right, so sugar comes in all different kinds of ways. We got glucose tabs. Those little honey packets that look like ketchup packets, those are amazing. You can keep those in your pockets. Juice, regular soda, not diet, whole milk, and candies. If they cannot sit up and swallow, because you don't want to be shoving hard candies down someone's throat who's, right? Right. All right, so what are our alternatives then? Yes, so we have, you can check for a medical alert bracelet or tattoo and see if they have a glucagon nasal spray on them. So you can give that, and then you can call 911. All right? So things to remember. Now I got a couple of questions for you. High blood sugar can also make people who are diabetic a little bit off, right? So if you don't know if the sugar is high or low, should you give them sugar?
Yes.
All right, we got some contention. I like this. So if your sugar is 440 and you drink a big old juice and you get it up to 470, no big deal. I can take care of all of that. Okay, we got it. If your sugar is 40 and you don't get juice and it drops down to 20 for another 20 minutes, that's a bigger problem because all of your tissues were starved for that amount of time. All right, so if you don't know, just go ahead and give it. If you live with someone who's diabetic, learn how to use their glucometer, okay? Second thing, we see this in the community all of the time. If someone's diabetic and they're having a problem, you give them their medication, right? That's what you're supposed to do. So we see people who have low blood sugar and their family is worried, so they give them a shot of insulin. This happens all the time, okay? So when you guys become internal medicine and family doctors, please educate your patients about making sure that the medication doesn't help. And you as well. Do not give any medications unless you know what you're dealing with. Sound good? All right.
Ma'am, are you okay? Hello? Are you okay, ma'am? Hey, wake up! Wake up! She looks like she needs some help. Yeah, let's call 911. Okay. Hey, wake up! You can't be sleeping out here. Look, she has this opioid overdose kit. Oh, man. Here, check her breathing and her airway. Use those as gloves. You think she might be OD? She might be overdosed. Now, I'm gonna lift your head up, okay? Are you okay? What's inside? So it looks like you use this and you spray this in her nose. Okay. So just press that with your thumb firmly. I'm gonna call for help. How long does it take, you know? They said it'll be a minute, so let's just wait for help. Okay. We're gonna get you some help, man. Help is on the way.
Opiate abuse is an epidemic in the U.S. A person who uses opiates may overdose, causing their breathing to slow down or stop. If a person overdoses, there is an antidote called Narcan. This medication may be sprayed into the nostrils to reverse the effects of the opiates. If you suspect opiate overdose, call 911. Use the Narcan kit and start CPR if they do not respond.
All right, so in the other course that I teach, HOPES, you can YouTube, there was this episode at a CVS pharmacy over on 8 Mile where someone came in, became unresponsive due to opiates, and for the 8 minutes it took EMS to arrive, you see the pharmacist kind of walking around, never got Narcan, didn't put him in the recovery position. And the whole time I'm like, oh my gosh, is this guy breathing? EMS arrives, a spray, and 30 seconds later, or a minute and a half later, he's up and just like stands up. So if you've not seen what this looks like, there are some YouTube videos out there. It's pretty dramatic when it actually does reverse. People with opiate overdose will have small pupils, slow breathing, maybe unresponsive. You do want to call 911 if there is a Narcan kit available. Detroit versus Addiction has been very good about getting kits out there. And if that's something you're interested in, you can join their group as well. They have a lot more information, are very involved. We're going to go over the recovery position in a little bit to show how to actually get someone on their side. So they're, why don't you want to leave someone flat on their back if they're unresponsive? They'll choke on their saliva. You got it, or their tongue. And then the second thing, Narcan, it's the reversal agent for opiates. Okay, so if you have someone who just spent their last $20 on a hit and you take that away and put them into direct withdrawal, if it's someone that you do not know that you just came across, they may be very agitated. Okay, so that safety first comes into play in these situations of making sure that you're a safe distance away and in a safe zone. Okay?
Up. Don't miss it. Nice shot, dude.
Want to put some money on this game? Dude, are you okay?
It looks like he's having a seizure. Here, help him to the ground.
Should I hold him down?
No, give him some space. Also, gotta make sure everything is out of the way.
Okay. What time is it? We should time his seizure.
2:19.
2:19? Here, let me put a jacket under his head.
I'm gonna put my wallet in his mouth so he doesn't swallow his tongue.
No, don't put anything in anyone's mouth when they're having a seizure.
For seizures, move the furniture or other objects out of the way so the person doesn't get hurt. You can put something soft under their head to help protect them. Make sure that you time the seizure so that you have an accurate measure of how long the seizure lasted. Never put anything in the mouth of a person who is seizing. Call 911.
It looked like his seizure stopped. And he looks like he's breathing fine.
Okay, I'm gonna put him in the recovery position. I'm gonna cross his leg, and then I'm gonna move his hand under his cheek to keep his airway open. You're gonna help me push him towards you, okay?
After the seizure, check to see if the person is responsive and breathing. If they have fluid or blood in their mouth, roll them onto their side into the recovery position. After a period of time, the person should become more alert, but will be confused for several minutes. Stay with them during this time until help arrives. If it is easily available, get a first aid kit. In some instances, there may be blood from the person biting their tongue or lips. You should wear gloves when touching the patient and can use the gauze from the first aid kit to stop the bleeding.
John, are you feeling okay?
I'm feeling a lot better, thank you. I'm so glad you guys were there. Yeah, I don't think I've drank very much, and I was up all night studying. Pulled an all-nighter.
Well, you know, lack of sleep and dehydration can provoke a seizure.
Absolutely. I'm lucky you guys were there to catch me.
Well, I'm glad we had that first aid class.
Me too.
All right. So, like I said, take a look at a video to see what generalized tonic-clonic seizures look like. They should last less than 3 minutes. If they're longer than 3 minutes, that's a big deal. That's why it's a good idea to call 911 so that EMS can be on the way if it's lasting longer. Also, that post-ictal episode usually lasts 10 minutes, okay? So they won't be able to say their name or say anything coherently for about 10 minutes. After that, if it's lasting longer, that also could be a sign of a bigger deal, okay? The things they used to teach to put things in people's mouths, okay, so that's why we specifically covered that. What that ends up doing is just pushes the tongue back and obstructs the airway. So never put anything. You can try to roll them on their side earlier while they're actively seizing. It's hard though, depending on where you're at and how the body is moving. But if you can get them somewhat off to the side, again, those secretions can get out of their airway and it's helpful. If you have a patient who is unresponsive but breathing and you need to leave them, you never want to leave someone flat on their back. They may have secretions, vomit, or other objects that could obstruct the airway while you're gone. So you want to put this person in the recovery position. Very easy to do. Step one, you're going to get this arm out of the way. You're going to bring everything towards you. So this arm is going to cross the body. This leg is going to be crossed. And then anytime you move someone, you want to move by the shoulder and the hip, and then you're going to roll towards you. Now, if I were to leave him just like this, he may roll and fall. He's not secure until I give him a kickstand. Now, he's not going to go in any direction. You want to make sure that the face has a space for secretions or vomit to pool. That's out of the airway. And now he's safe to be left.
Now he's been wanting to put garlic chives in everything.
Well, not everything.
Dad, the side of your face is drooping. Mom?
It's probably nothing.
Dad, are you okay?
You're slurring. Why are you slurring? Raise your arms up in the air for me.
Dad, are you okay?
Gracie, call 911.
I just...
Honey?
Oh, Dad!
Tim!
I need an ambulance to send for a
Tim!
rescue?
Tim, look at me, Gracie. Tell them to hurry. Tim, look at me. Look at me, Tim.
Mom, what do I tell
I don't know. I think he's having a stroke.
I think my dad is having a stroke.
Tim, what's going on, baby? My husband, he. I think he's cold. Are you cold, honey? Are you cold? Okay. Gracie. See, Gracie's gonna come, sweetheart. We're just gonna go. We're just gonna go in the ambulance right now. We're gonna go to the hospital. Okay? Okay. Huh? I'm right here. I'm right here. Gracie, meet us there. I'm right here. I'm right here. Okay. Okay, here we go. You just stay right here. You just stay and breathe. Just breathe. Tim? Tim?
Dad? Dad?
How you feeling?
I'm fine.
Well, you've had a stroke. But because you got here quickly, you're looking at a full recovery.
All right. So I found that if we do it right now, you're going to remember this for the rest of your life. So everybody, give me a big smile. Hey, look at all those smiles. All right. I want everyone to raise both your arms. What you're looking for is sometimes the arm will drift, and that's a sign, or sometimes it won't raise at all. Okay, so those are the two signs. If you see a drift, that's also bad. You can check the legs too. Speech, people, their name is one of the first things that gets embedded in their brain. So if you ask their name and they're still aphasic, they might be able to give you their name. So you can ask what month it is it? Where are we at? Just try to get them to talk. Receptive and expressive aphasia, have you guys learned that yet? All right, so you might have either of those or just dysarthria because half their face isn't working and they're going to be slurring. Those are the things you're looking for. And then time is not only time to call 911, but it is when was the last time they were normal. Okay, so this guy, what did he say when he first walked in? Just got back from the store, didn't take long at all. So maybe he knew 20 minutes ago she was normal. That's super helpful so we know how to time things. Sound good? Aspirin. Do not give aspirin. Why? Yeah, half of the strokes, not half, but some strokes are hemorrhagic, so there's blood in the brain. If you give aspirin, points off.
Hey, Dara. What? Dara.
Dara.
Are you?
sitting
Are
up?
you okay?
What's going on? Are you
don't
feeling
look
all right?
good. What's happening?
What's going on?
short of breath.
You got your
Oh.
fist at your chest.
Tightness in my chest.
Wow. No pain?
Just tightness.
You starting to perspire, Dara. What's going on?
What, talk to us. What's happening? Huh?
Undo her top button so she can get some air. Dara, I think you might be having a heart attack.
Yeah. You know what? Women can have a heart attack without having any chest pain. This is not good. Just tightness. You need to lay back. Lay back. Listen, I'm going to go and get the first aid kit and the AED, and I'll be right back.
And let me dial 911. The emergency here is at the library at the Wayne State Medical School. Yes, I'm attending to a heart attack. Yes. She's female? Yes. Yes. Can you send help right away? Thank you so much. Thank you. Thank you. Yes, I'll stay on the phone. Right here.
Heart disease is the leading cause of death worldwide and in Detroit. A heart attack is when the blood vessels of the heart muscle get blocked by a clot. A person having a heart attack may feel chest pressure or heaviness that extends to the jaw or shoulder. They may have symptoms such as shortness of breath, nausea, sweating, or weakness. However, elderly, women, and diabetics may not have the typical symptoms of chest pressure or heaviness. They still can have the symptoms of shortness of breath, nausea, sweating, or weakness. If you suspect a heart attack, call 911 and have them rest. Get an AED and first aid kit. Have them take aspirin and start CPR if they collapse.
I got back as fast as I could. I've got the first aid kit and the AED, and I brought some aspirin for you. So I want you to take one of these. You're looking better. How are you feeling right now?
We're right over here. We're right over here.
Hello, so you all just saw me have a heart attack. Well, I want you to know the importance of knowing your numbers, because keeping up with your high blood pressure or hypertension will help prevent you having a heart attack or stroke. So that means making sure that you reduce your salt intake, get some exercise, adequate sleep, change your lifestyle as far as eating more fruits and vegetables, and make sure if you have hypertension or high blood pressure that you consult closely with your doctor, because he or she will help you to be able to maintain your hypertension or high blood pressure. So now you know the importance of keeping track of your numbers. Thank you.
We just talked about heart attack, okay? And so what exactly is a heart attack versus cardiac arrest? This is a concept that in the community isn't quite discussed. But basically, the heart is a muscle and it needs blood, just like every other organ, right? And so when one of those three vessels is blocked, that distal flow, you're not going to get blood flow, and the heart muscle becomes ischemic. Ischemic tissue sends pain receptors back, and you get chest pain and shortness of breath and all of those other things. Cardiac arrest, on the other hand, is either the pump has no power and no longer can squeeze, or it's an electrical problem. The normal sinus node and down is disrupted, and you can just get disrupted electrical activity, okay? And the heart, when it's not coordinated, doesn't pump, pump fails, and effectively, you're in cardiac arrest. So someone with a heart attack is awake and talking and complaining of their chest pressure, shortness of breath, nausea, lightheadedness, etc. In that case, like we talked about, you'll call 911, you'll get your AED, and you can give them aspirin. Someone in cardiac arrest, their pump is not giving any blood to their brain. They are unresponsive. They have just collapsed. You cannot wake them up. They may have what's called agonal respirations, okay? If you've ever gone fishing, that guppy breath that fish will take, it's a reflex, okay? People will have that as well. It's a breath every 10 to 20 seconds. And it used to be confusing because it looks like they're gasping. So is that breathing? Is it not breathing? It's confusing. So you may see that. But in that case, you're also going to call 911. You're also going to get an AED, and you're going to start CPR, okay? So again, AEDs, know where they're at. It's super important. So what is CPR? Cardiopulmonary resuscitation. Basically, you are an external pump for the heart to try to get some blood and some oxygen to the core tissues so that they also do not become profoundly hypoxic and get past the point of return. You're going to use this for anytime someone has immediate cardiac arrest. Now so this was supposed to be part of your orientation back last year, but COVID, okay? At the same time, you were also supposed to have a BLS class, a basic life support class. Basic life support's a little bit different than this. What we are doing right now is hands-only CPR. And why are we doing that? Because basic life support's a little confusing for some people. You got to do 30 to 2, or was it 15 to 2 for kids with 2 people, or I don't remember. It's confusing, I'm not going to do anything. Or you come across someone with a big bushy beard, and right before they had their cardiac arrest, or during their arrest, they vomited, and now there's chili in that big bushy beard, right? And people are looking like, I don't want to do mouth-to-mouth on this stranger with chili in his big bushy beard, right? So because they thought they weren't going to do that step, they wouldn't do anything, okay? And time would pass, the 3 to 10 minutes before EMS arrived, and at that point, the damage was too far gone. So there's been a national initiative to switch to hands-only CPR in community settings. In the hospital, you shall still do 30 to 2 with a bag valve mask, okay? You'll get to that when you get to your class. But they found in places like Seattle, where in the 70s they taught CPR to high school students, and they initially started doing this, more than 70% of people who have an outside of the hospital cardiac arrest will get CPR prior to arrival. In Detroit, we were less than 4%. Okay? So the last initiative since the last 5 years, we've gotten our numbers crazy high. We've been doing a lot of hands-only CPR classes, we've been teaching in the community, and our numbers are much better now in Detroit. Survival still, in all perfect situation, is still low. It's about 6% of people with an outside of hospital cardiac arrest will survive to discharge. It's a low number, all right? When you watch TV, it seems like it's gonna be higher. It's not, okay? But if you can start CPR early, if you can get an AED early, those are the people who you can save lives. A couple other things that were taken out, so you're not doing mouth-to-mouth anymore. You're also not checking for a pulse. Everyone find your carotid pulse for me right now. All right, everyone find your radial pulse for me right now. Everyone find your dorsal pedis pulse? Just kidding. All right, but you should be really good at that, okay? So you guys are trained professionals. You should be very good at finding pulses in all 5 zones. Lay people, what they found is they would mess around for like a minute and a half and still not feel confident. They feel one, did they not feel one? And it just delayed. The other thing is respirations. They used to teach check for respirations, and that gasping would confuse people, right? So that person would take this gasp and they're like, well, I guess they're breathing, so they must have a pulse. I guess I'm not gonna do anything. And just delayed the time to CPR. So they took all that out and said, if someone is unresponsive, start CPR, right? Easy peasy? Okay. So if you see a cardiac arrest, you're gonna check for responsiveness. How do you do that? You're gonna tap them, you're gonna shake them, you're gonna shout, okay? If you do all that and they do not respond, if they moan, if they kind of That's a response, okay? I'm saying there's nothing, okay? If they have no response, then you are going to call 911. And how are you guys going to get me to call 911? I'll call 911. All right, good. You're going to put it on your speakerphone and call 911. And then if you can get an AED, that's going to make all the difference. So here you would say, go outside and grab that AED, go up to the second floor and grab the AED. You're at Meyer, go to aisle 26 and grab the AED, okay? And then you need to have the person on a hard surface. What happens if you do CPR on a bed? Yeah, you're just moving the mattress, okay? You're not actually compressing the chest wall, all right? So you need someone on a hard surface, and then you're gonna start chest compressions. So how do you do chest compressions effectively is what we're gonna cover next. So rule number 1, you need your hand placement. So I like intertwined, okay? You can do this. If you have a hand problem for whatever reason, you can grab your own wrist, but you're gonna be pushing through the palm of your hand, okay? I see a lot of people, they put the whole thing, but I mean the heel. You just want this heel is gonna be doing all the work. Next, this heel of your hand is gonna be in the center bottom part of the sternum. On a male, it's between the nipple line, but it's the lower half of the sternum. There's kind of a natural indent there, and that's where your hand should go. If you're too high, it's not gonna work. If you're on the belly, it's not gonna work. You try not to break off the xiphoid process. You wanna be a little bit higher, okay? But the lower part of the sternum. Even if you work out a ton and you can deadlift 300 pounds and you can bench press whatever, your arms are not strong enough for CPR, okay? You cannot do this for CPR. I want everyone to put your arms out, rotate your elbows in. You can feel how that locks your elbows and your shoulders. So not like this, you wanna rotate them inward. And then you're gonna bounce at your waist, okay? That's the only way that this works. You guys will find out because we have the 3rd and 4th year medical students do all of our CPR. All right, so in 3rd and 4th year medical, yep, you guys will be our machines because we don't have enough techs, our nurses are busy, you guys do the CPR. All right, so we need effective CPR from you. Number 2, I am not a super big person. And so I have found this is big for me. If I am sitting back at all, I cannot get the depth. I need to have my shoulders directly over my elbows, over my wrists. And that means my knees are right up against the person and I'm leaning right over them. Okay, this is big. If you're strong, you can get away without doing this. But for me, I know I need to be up close and directly over. And then you're gonna start compressions. So there's whole Spotify playlists that you can find for 100 to 120 beats per minute. You got the Bee Gees, Stayin' Alive, Natural Woman by Aretha Franklin is one of my favorites, Beyonce. The reason though, if you are going too slow, you're not pumping enough blood. If you're going too fast, you're not giving time for the heart to fill up with blood, and it actually is counterintuitive. You're keeping that heart flat, you're not actually pumping blood. So you have to go at this rate. And what is this rate, you say? Everyone stand up, this is the dancing part. All right. I can't get it to stop now. All right. So I don't care what song you pick. Try to sing it in your head. Don't sing it out loud. It looks a little creepy on the scene, okay? But when we're practicing, if you see one of your counterparts is going too fast or too slow, go ahead and start clapping or sing it out. You can go online, there's metronomes, you can play the songs, I don't care. It gets a little bit loud when we're doing this, but the rate is super, super, super important. Okay, rule number 1, you're gonna keep doing compressions. Every time you stop doing compressions, it's kind of like those old wells, you know, those like pump wells you see at the old parks. When you stop, it takes 15 pumps to get that blood going again. So every time you take a break, your gap is longer than that. You're actually adding like another 30 seconds where no perfusion is happening. So minimize interruptions. The AED will tell you to stop every 2 minutes so it can do a rhythm check. So about every 2 minutes, there will be a pause. That's a nice natural time to switch people. If you get tired and you need to switch earlier than that, do it seamlessly. We're gonna switch on 5. 1, 2, 3, 4, 5, and the other person jumps right on in without a break. Okay, that's your goal. So CPR is quite easy to perform once you have some of the basic skills. We're going to be doing hands-only CPR, which is hands-only. We're not going to be doing any rescue breaths. We're not going to be checking for pulse, and we're not going to be checking for breathing. First thing you'll check is for responsiveness. This can be done with a tap or a shout. Hello, hello, can you hear me? If the patient is unresponsive, you're going to call 911, get an AED or have someone get an AED, and then start CPR immediately. For effective CPR, hand position, you can interlock your fingers, you can grab your wrist, but the main thing you want is to use the heel of your hand, and you want your arms to be straight. So if you're using your arms at all in this motion, your arms are very weak. You want to instead lock your elbows by kind of locking your shoulders, and then use the upper half of your body weight to perform the compressions. The heel of your hand is going to go right in the center of the chest. You do not want to be up high. You want to be kind of on the lower portion of the chest, kind of between the nipple line. There's a divot in the sternum that's kind of where you want your hand. You don't want to be over the belly, obviously, but if you're too high, it's not as effective as a little bit lower down. So I'll interlace my hands, have my elbows locked right over the center, and then I do want my shoulders over my elbows, over my wrists. If I'm sitting back at all, I will not be able to generate enough force. So I want to make sure I'm really right over the person. And then I'm going to do 100 beats per minute. Too fast, faster than 100 beats per minute does not allow the heart to refill, and it's actually detrimental to the CPR, and too slow also is not effective in pumping the blood. So 100 beats per minute is Staying Alive by the Bee Gees. Staying alive, I'll let you guys sing on your own. So effective CPR will look like this. You're going about 1/3 of the depth of the chest. If you see someone who is doing this, I'm using my arms, and that is not effective. If you see someone who is trying and they're sitting back, this will not be effective. If you see someone whose hand placement is anywhere other than the center of the chest, this will not be effective. And if you see someone going too fast or too slow, that won't be effective either. So you can help correct people in real time. And again, what you're looking for, straight arms, center of the chest, shoulders over wrists, 100 beats per minute. Thank you very much. And then if you're alone doing CPR and someone comes over and they're like, I've never done it before, you can teach them. Just what I just taught you right now. Just keep your elbows, lean forward, don't bend them. You got this. Go a little slower, go a little faster. No big deal, okay? So you guys are now officially trained to train other people. Something like that. When you call 911, this is actually a huge initiative. 911 dispatchers are now trained to talk you through this. Okay, so this is a big deal. If you forget everything I said, they'll talk you through it. And then the AED can also kind of help a little bit. It beeps at a rate of 100 beats per minute. Okay, so if all else fails, follow the beeping. But AEDs, when you get to BLS, actually, when you get to ACLS, you'll learn there's kind of 4 different heart rhythms for cardiac arrest. PEA and asystole don't get shocked, but VFib and VTAC do get shocked. You don't have to learn that today. You'll learn that in a couple years. But the AED is smart enough to figure out which rhythm needs to get shocked. And if you are someone who had a VFib or VTAC arrest and someone started CPR and got an AED, those are the people that walk out of the hospital alive, neurologically intact. Okay, so AEDs, if you get someone in that rhythm, this is how you save a life. So how do you use an AED? It's actually super easy. You see 1, 2, 3 on the side. It's 1, 2, 3. Number 1, you turn it on. Right? Like it's super, super easy. Number 2, you're gonna attach the pads. Now one thing that they don't tell you with this is that, remember I told you that people have shock and they get sweaty? Sometimes people are sweaty and the pads won't stick. So you might have to, when you take their shirt off, you might have to wipe them down to get these to stick. The other is some people have more body hair and these won't stick over body hair. Most AEDs have a razor, 3 quick swipes, you can stick that on, okay? It's usually the upper one, the side one usually doesn't cause as many problems. Some of them you have to plug in a connector, some it's already built in. It'll tell you if you need to plug it in or not. And then just listen to what it tells you to do, okay? It will beep at 100 beats per minute, so that'll keep you honest about your rate. It will at one point tell you, do not touch the patient analyzing, and that's why I want hands off, because if someone is continuing, it's gonna make it look like VTAC, and it'll shock it because it's confused. So make sure you're not touching anyone. It may say no shock advised, okay? And that's if someone's in asystole or PEA. If it says no shock advised, you're gonna jump right back into CPR. It'll tell you to start CPR again. If it does say that there's a shock advised, it'll tell you to stand clear, and that's whoever's gonna be pushing the button, you gotta look and make sure no one's touching the patient. And then it'll say, press the flashing orange button, and then you'll touch the flashing orange button. Once you do that, the patient's body will jump. They don't tell you this on the TV shows. When someone gets shocked, their body kind of jumps off of the ground. That's normal. It looks kind of dramatic, but that's normal, okay? And then it'll tell you shock delivered and you'll continue CPR. This is what it sounds like.
Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of patient. Deliver shock now. Press shock delivered. Begin CPR.
All right. So pretty easy, right? Also, when we are in the big group and everyone's doing this, this is really loud, so you can turn this on or off if you'd like. Now we don't have to have 8 of them playing at once. All right. This obviously is a mini. The real ones are a little bit bigger, but they're all pretty much the same. Any questions so far? Rock and roll. Okay, pad placement. So if you ever forget, it's on the pads, so you can just look. But these are designed that the atria through the apex, the shock goes straight from the top of the heart to the bottom. So this is intentional where these are placed, right side of the patient and then on the side. Actually, it's a slide over. So this is pretty easy, so just always look at the pads. Sometimes I see people flip-flop them and then you're going through the apex up. It's not a big deal, but they need to be in the right direction. Otherwise, the electricity is going backwards through the heart and you might create some issues there. Okay? And what is it doing? It's basically stopping the heart in hopes that it'll restart normally. Okay? Other things to consider. Number 1, anyone can save a life. You guys are officially armed and dangerous in terms of saving lives. Okay? We talked about this. The AED shock will cause someone's body to jump. You cannot hurt someone who is already dead, okay? When you start CPR, you are gonna feel snap, crackle, and pop, okay? Most of that is that there are all of those rib to sternum joints and you're, popping them, okay? You might be breaking some ribs, okay? Can you live with a broken rib? Yes. So don't worry about that if you feel snap, crackle, and pop. It is a little disconcerting, but keep going, okay? You want to minimize interruptions. We talked about that. Gasping is not breathing, so do not get confused if you see that. Continue CPR anyway. The only time I want you to stop CPR if someone wakes up and pushes your hand away, okay? That means you've done well. If you shock them and continue CPR, they may wake up on you, and that's a good thing, okay? You can stop at that point. But I have seen sometimes CPR is so effective that you perfuse the brain, and then when you stop, they go unresponsive again. Okay, so you may just, if they do, continue CPR again, start the AED over again. Okay? All right, we are gonna switch gears to children. So kids are a little bit different in terms of how we consider CPR in kids. So if you have a witnessed arrest, okay, a child is running, playing, and they fall to the ground unresponsive, you want to call 911, get an AED, and start CPR. But if you come across a child who is unresponsive, so who knows how long it's been since they collapsed, time is more sensitive in small bodies. You want to start CPR first and then take the time to call 911. So 2 minutes of CPR first. Okay, so that's one difference if the child is found unresponsive. Placement and compressions are a little bit different as well. Okay, so for infants, it's the same location, but you only need the power of your thumbs or 2 fingers to compress against about 1/3 of the depth of the chest. For a child, it may just be a one-handed technique instead of a two-handed technique, okay, because it doesn't take as much power. Children also, respiratory arrest is more of a common cause. Adults have pump problems. They usually have a respiratory problem that causes hypoxia, that causes their heart to stop, okay? So you want to address that hypoxia first, so you can and should do rescue breaths on children. And I don't think it's as much of a concern of people giving mouth-to-mouth to a child they don't know, typically, as a big man with a big bushy beard. Sorry to those with beards. It's nothing against you in particular, but you know what I'm saying, okay? So you can choose this. The other thing is, on the ski patrol, we have rescue masks that you can buy for $10 through CPR. It's an adult and pediatric mask that you keep in your pocket. It has a built-in filter, so those exist. They also have keychains. They're a buck a piece that is a kind of piece of film that has a filter in the middle that you just put over someone's face and it acts as a film. So if you want to be a renegade med student, these are purchasable and easy to obtain to have with your first aid kit, a rescue mask with you at all times. I mean, heck, we can even get a First Aid First logo on there, a buck, you know what I mean. Anyway, so are your lungs bigger than a child's lungs? Okay, so step number 1, you want to keep a neutral position. If you flex a baby's head or extend a baby's head, their airways are so small you can obstruct the airway. So you want just a nice neutral position. You're going to do a gentle puff just to watch the chest rise, okay? The other times you can consider rescue breaths, so infants and children, drowning victims, because we know that their arrest was due to a hypoxic failure, opiate overdoses, because again, we know it was due to a hypoxic failure, and then respiratory arrests such as choking, or someone who was having a severe asthma arrest and then became unresponsive and without a pulse. We know that those were hypoxic failures, so you can include the breaths on those. But again, if you don't have a pocket mask and you're not comfortable, at least do the compressions. Sound good? Okay. AEDs are a little bit different as well. They go straight front and back, okay? So this, again, still goes straight directly through the heart. There are pediatric pads, and so if the pads are smaller and they fit, you can use them the original way. But pediatric, just front and back, because you can't have the pads touch, otherwise they zap each other, okay? So front and back is the placement, which means you're gonna be doing CPR through that anterior pad, okay? So I just included that picture so you had that idea that that would still happen. So switching gears a little bit, this is kind of a poll of the audience. Okay, so this cause is a leading cause of death in infants and children, with 75% of the mortality being in kids less than 3 years of age. One child dies, oh, I included the last line, every 5 days. It's choking. Okay, so what is choking? I have to modify my animations. So choking is basically when the airway is completely blocked. And so super common in kids, especially kids under 3. So what can kids choke on? Things to consider. Button batteries are something, these also, if they're ingested, cause a big deal if they get stuck in the esophagus. Marbles are horrible. Balloons are not good around little kids under 3. Grapes. I don't think any ER doc in the world feeds their kids grapes unless they're cut in half. Any round fruit is a big, big hazard. Magnets. These again are a problem if you swallow 2 magnets. Those 2 pieces of small intestine adhere together and you get a bowel perforation. So magnets in kids are bad. Gooey things like peanut butter just are too thick sometimes and can occlude an airway. Small toys, hard objects like popcorn, crafting beads and things like that. These get up noses too all the time, ears. And then hot dogs, again, have to be cut into little pieces. Hot dogs are a big problem. Now, hot dogs, popcorn, and grapes are things that you can see at summer barbecues. The other thing you sometimes see at summer barbecues are kids running around with food in their hand and adults drinking beverages and not watching the kids, okay? A natural instinct for fight or flight, if a kid realizes all of a sudden they're in trouble, some kids will hide, which means you are not going to find that choking child until it's too late. So my recommendation is that at family gatherings where there are children, there is a rule that kids have to have their little fannies on a bench top or have to be sitting to eat. There's no like stray food around that they can run and eat. Sound good? Public service announcement number 1. All right, so what do you do if someone's choking? So the airway is blocked. If it's only partially blocked and they're still coughing, let them be, okay? Let them cough it out. If you come up to someone who's like partially choking and you whack them on the back, you startle them, they aspirate, now we have a complete obstruction, right? So let them be, but stay with them if they can't get it up. If they can't cough, can't speak, then we're gonna assist them, okay? Who here has ever choked? Yep, I choked when I was 8 at a Chinese restaurant. My dad gave me the Heimlich. Big mess of Chinese food all over the table afterwards. It was wonderful. I'm alive to tell the tale. All right, so how do we address choking? Number 1, back blows, okay? So they have people kind of slumped over. You can have them standing straight up. You still want a hand on them because when you use your full force, again, with the heel of your hand between the shoulder blades, you can knock them down, so keep them steady. And you're gonna do that 5 times. This is the same maneuver for adults, kids, and with infants. With infants, you can see that we are using gravity. Infants have floppy little heads, and you don't like to let that little floppy head dangle, so I usually kind of grab the face, and then you can also do back blows this way. Now, some infants are quite heavy, and again, I do work out, come on now, but I find I might take a knee, okay, because now I have more force and I'm not just supporting that baby with my arm, I have a way to support and lift it, okay? If that doesn't work, I want everyone to take a fist, put your fist above your belly button, below your xiphoid in that squishy part, that's where you're aiming, okay? On someone else, you're gonna wrap around and you're gonna go up and in. And you're gonna use a fair amount of force. Your objective is to increase the interthoracic pressure so that object comes out, okay? On a child, you may need to kneel to do this. On babies, we don't push on their bellies because their livers are soft and will crack, okay? So we're gonna do just like chest compressions and do chest compressions on babies, okay? So for infant choking, there's a couple of key things to keep in mind. First, you always want to support the head. So I usually have a thumb and forefinger supporting the jaw. You want to let gravity to its advantage so the head will be down. You will do 5 back blows using the heel of your hand between the shoulder blades, and you can be reasonably forceful. This is a life or death situation. If that does not clear the object, you will flip, again supporting the head. And instead of abdominal thrust, we always do chest thrusts in infants, and you'll do 1, 2, 3, 4, 5. I do find if this is a heavier infant, my arms may not be strong enough. I may take a knee to again give myself more force and a more stable platform. Thank you. So again, choking is something that you can see at any point at any time, and knowing how to resolve is definitely an important skill. Now, we were teaching this in the community, and there was a sweet woman who was 8.5 months pregnant. She's like, well, what if I choke? Which is a great question. So you want to go above the baby bump. You might be on the bottom part of the sternum, but again, your objective is to increase interthoracic pressure. So if you're squeezing at the sternum, you still can increase force, and that can work. What if you're all alone? You are going to put your hand in your fist, and you are going to kind of sumo drop over the back of a chair and try to generate that increased force, okay, by pushing this on yourself. Again, when we were teaching in the community, a gentleman said he was driving in the car on the freeway when he started choking. He pulled over, rolled down the window, and did this over the edge of the car window and lived to tell the tale. Right? Wow. All right. So there are things that you might be able to do. Now, if you are unsuccessful, at some point this person is not going to be perfusing oxygen to their brain. They will go unresponsive. What do we do with people who are unresponsive? We call 911, we start CPR, and we get an AED. Okay, so if someone becomes unresponsive, you're going to go ahead. Now, I said with respiratory emergencies, you can try to give a rescue breath. At some point with the CPR, you may partially dislodge this. If you're passing air and you're seeing chest rise, go for it. That's helpful. They will teach in BLS, if you see an object in the mouth, you can grab it and take it out. If you do not see anything, don't blind sweep. They used to teach blind sweeping. What that does is it pushes objects further down. Usually the objects are too far to see. They're down in the hypopharynx. You won't see them. Okay. Okay. I shall believe that that is everything I have for medical emergencies, hands-only CPR, AEDs, and choking.
Hello, are you okay? Hello, are you okay? Can you hear me? Oh, okay, I'm gonna call 911. Hello? I have a male on the ground. It appears like he hit his head. He had an accident on the skateboard. Yes. He's breathing, but he's not conscious. We're at Hart Plaza at the water fountain, downtown Detroit. Okay, just keep responding to him. Okay, hold on. Now you guys are not gonna hang up, are you? Okay, hold on. Hello? Are you okay? Are you okay? Oh, don't move your head. Don't move your head.
What happened?
It appears you must have fell off your skateboard and bumped your head.
Where am I?
You're downtown Detroit, Hart Plaza. It seemed like you were skating, like I said, just bump your head. No, keep your body still. Don't move. I just called 911. They're on the phone with me now, so.
Where am I?
You're downtown Detroit, Hart Plaza.
What happened?
You had a skateboard accident. You would bump your head. Just hold your head stable, okay?
With more serious accidents, we should be concerned about injury to the head and back. Head injuries can damage the brain, and back injuries can damage the spinal cord. Both these types of injuries are very serious, and you should respond to them quickly by calling 911. Accidents that cause more serious injuries include things such as being hit in the head, diving into a shallow pool, being in a car accident, falling from a height such as a ladder, roof, or stairs, and crashing on a bike or skateboard, especially if they are not wearing a helmet or if the impact breaks the helmet.
Yes, he's responding now. So you guys are on the way?
Awesome. Okay, I'm gonna keep talking to him. Hold on. Can you hear me?
Where am I?
You're downtown Detroit, Park Plaza.
What happened?
It seems like you might have fell off your skateboard and bumped your head. No, just hold still. I need you to stay still. Just hold your head still, okay? I just called 911. They're on the way, so they should be here shortly. Just breathe. Just slowly breathe. You're doing good. Okay.
Suspect head or back injury if an injured person does any of the following: does not respond or is only moaning, acts sleepy or confused, vomits, has tingling or weakness in their arms or legs, complain of head, neck, or back pain, has a seizure, or trouble walking or seeing. You must be careful not to move someone who may have a head, neck, or back injury. Bending, lifting, or twisting an injured person's head or neck can cause further injury, such as paralysis or even death. The only time you should move someone is if you need to get them out of immediate danger. Try to keep them as still as possible and drag them to safety.
All right. So head injuries are very, very, very common things that we see in the emergency department. Car accidents, football injuries, all kinds of injuries to the head. Here with those birds or limes, those little scooters, oh my golly, those things hit everything and people come in all the time with all kinds of injuries. So the main thing you can do in a first aid situation is keep someone still until help arrives, especially if they have any concerning signs or symptoms. Now there's one caveat. Who here knows anyone who's on blood thinners? Blood thinners are becoming more and more common to treat things like AFib, blood clots, mechanical valves, etc. If you have a minor injury to the head, a fall from standing height on a blood thinner, that can cause serious intracranial hemorrhage. Okay, so anyone who's on a blood thinner, if they mildly bump their head, they need to go get checked out. Even if they have no symptoms, you can have delayed subdurals that don't get found for a couple of weeks. People have trouble walking and some other symptoms because a head injury was missed a while ago. Okay, so this one's pretty easy. Keep them still, and if they're on any kind of blood thinner, absolutely go get checked out. Questions?
I don't have time for this. Look at these cute kids. Oh my goodness, look at that thing. It's so adorable. Like, I had this one. Whoa, dude. What is it? Your nose is bleeding. My nose? Yeah. Kind of a lot. But don't worry, nosebleeds are really easy to control. Bleeding. Oh, it's bleeding bad. Am I gonna die? No, you're gonna be just fine, dude. But first thing with the nosebleed, you always want to have your personal protective gear. So I'm gonna put on my glasses here. And I'm going to give you these napkins because I don't want to touch your blood. Okay. Let me just pinch off the bridge of my nose here. No, you don't want to pinch off the bridge of the nose. You always want to pinch off the squishy part. The squishy part? Yeah. Are you sure? Yes, absolutely.
I heard you want to lean back and let it pool.
Oh, no. You never want to do that because otherwise you're going to swallow all your blood. You always want to lean forward and to let gravity do its job. Okay?
Forward, okay.
Yeah, and so hold that for about 5 to 10 minutes, okay, Brian?
Okay, thanks, John.
Yeah, no problem. But dude, I've been telling you all this time, you gotta stop with Med School Fight Club. It's killing you.
First rule, there is no Fight Club. Rule number 1. Rule number 2, there is no Fight Club.
You're right. Never talk about Fight Club.
Okay. So you will come across a lot of people, especially in the community or people who are over the age of 40 to 50, who are taught completely backwards. They were told to pinch the bridge of the nose and lean backwards. Okay, so you really, Kesselbach's triangle in the anterior surface is where most bleeds happen. The most common etiology is digital trauma. Okay, so often nosebleeds are on the right side because most people are right-handed. Swear, I can't make this stuff up, okay? So what you're gonna do is pinch, lean forward. Never ever put things in the nose. I see a lot of people, they wad up tissue paper, they put it up there and they hold. What that does is it forms a great clot that you remove when you remove the tissue, and then the bleeding can start. Also, you just scratched the rest of the interior aspect of the nasal, so never anything up the nose. Because you guys are medical students, I will share 2 tips that I teach in the emergency departments when we have nosebleeds. Number 1, we use Afrin. Afrin is an over-the-counter vasoconstrictive medication used for nasal congestion. Works great for nosebleeds. We usually have people gently blow out any big clots, spray a couple of big sprays up the nostril, and then hold for 5 minutes. Stops most nosebleeds. Once the bleeding is stopped, I'll then take a pea-sized amount of Neosporin, put it up the nostril, squish it around. It's thick enough, it keeps the bleeding stopped, and it moisturizes inside the nostril, which is the second cause of nosebleeds. Now, I mentioned blood thinners a couple minutes ago. People with nosebleeds on blood thinners is life-threatening. This is like a faucet coming out. You can lose a large amount of blood quickly. So usually the rule of thumb is squeeze for 5 minutes. If it's still bleeding, do another 10 minutes. If it's still bleeding, come in. If someone's on a blood thinner and they're bleeding, you can have them hold pressure as you start kind of driving in. We'll do all those treatments, and sometimes we might need to pack. Extremity injuries. This happens all the time. Again, with those birds, people fall off and they break wrists and collarbones and ankles and all kinds of things. So what do you do if you have someone with an extremity injury? We're going to do RICEs. Okay, this is a mnemonic you can keep in the back of your mind. It looks like some people are actually trying to switch it to the word rise and taking out compression. But that's only because people do ACE wraps wrong. They crank those puppies on and you lose all blood flow. So as long as you're putting it out nice and gentle, you can still compress. All right, so rest. If the upper extremity starts right here, right, at the manubrium, this is where the clavicle starts. So if anyone has any kind of an upper extremity injury, you want to use a sling. And actually, in the Stop the Bleed kit, in one of them, team, we have some scarves. If you can find those for me, that'd be amazing. Oh, look, you're so fast. All right, so we actually need to start having Wayne State scarves. So if everyone gets to the point of wearing scarves, you will not only be armed with all of the others, you'll be armed on how to make a sling. Super easy. So, like the picture, you first want to make yourself like Miss America. Da-da-da. All right. I've seen if you try to do this any other way, you're going to forget and it's going to mess up. So drape this over the body first, then the arm, flip it over the other side, and you got yourself a sling. Cool, huh? You're just going to tie this behind the neck, and you're good to go. This gets you from the house to the hospital without the arm bumping all around. Now, if I have a shoulder injury or a clavicle injury, I dislocated my shoulder or I broke my clavicle, is this helping prevent this movement? Not at all. So you will second this with what's called a swath, basically another piece of cloth or whatever you just tie around the body, and it just holds that arm in place. Easy peasy? All right, you guys can now know how to make slings. Triangular cravats, they come in all first aid kits. You're like, what the heck is this thing for? That's what it's for. Okay, so basically the point of the triangle is where the elbow sits. Okay, as long as you drape it and point that point towards the elbow, you'll be able to make a sling no problem. Cool? All right. What if you hurt a leg? My friend with the Achilles rupture, how was I supposed to get her out of there? I don't want her walking on that leg, right? This is where the human crutch or the two-person assist comes into play. Super easy. The injured leg goes towards the helper, okay, and then they can hop. All right, super easy? All right. That was rest. I is for ice. Ice is the best pain medication known to man because it helps numb and it prevents swelling. Swelling is what causes pain and injury. You do not want to put ice directly against the skin because then you'll get frostbite. So you'll put some layer of clothing or a washcloth or something between the ice and the skin, and that usually does the trick. You'll put ice on for 20 minutes, take it off for 20 minutes, keep it on for 20 minutes. It's usually good for the first couple of days where swelling is an issue. After that, heat helps. But for the first 72 hours, ice is where you want to go. Cool? All right. What comes next? Compress. ACE wraps get a bad name, but a little bit of compression goes a long way. If you have someone who's out hiking and they twist their ankle, but they have a nice pair of tight, high hiking boots, leave the boot on because it helps compress that ankle. As soon as you take it off, that thing just puffs up and then you can't get their foot back in the boot. You guys have been there, right? Okay. The same goes, people with all kinds of injuries, but they have those like Lycra tight undershirts. That helps just with swelling, same with long johns, just to help kind of compress. The only problem with ACE wraps, again, they crank them on. If you crank it on, you're gonna get dusky fingers and toes. They'll get that kind of venous congestion. You don't want that. But a nicely wrapped ACE wrap does a good job. Elevate, yes ma'am. I missed a brace. I missed the word that you used. I heard football something. Those are below. Like they don't. It's more like it's almost like those work boots or those like Doc Martin, those boots that go up high. Those, but if it's below it, doesn't really help that much. It actually just acts like an extra weight, so you can take the other shoes off. Good question. Elevation also helps with swelling. Swelling is the enemy. You do not want these things to get swollen because then they'll hurt more and it takes longer to heal. So if you can lift the injury above the heart, that helps. I see people with injured wrists come in all the time to the emergency room carrying them like this. And I say, go ahead and pledge allegiance while you're sitting in here. I'll get you an ice pack. But keeping this above the heart is going to help quite a bit. Same with lifting legs. People who have facial trauma, if they have a swollen eye, if they lie down flat that night, they're going to wake up with a swollen eye and they won't be able to open it. So I say, kind of add a bunch of extra pillows tonight. That'll help. Works for sore throats as well. Splinting. So I do not expect you guys to become experts at splinting, but I want you to know the objectives. So if someone injures and has a mid-shaft radius ulnar, forearm fracture, your objective is what? They broke these bones. What do you want to immobilize? What's the joints above and below? So what's the joint below? The wrist. So you want to make sure the wrist isn't moving, and what's the other one? The elbow. So a forearm fracture, you need a splint that comes all the way over here, contains the elbow, and contains the wrist. Okay? For a wrist injury, you want to mobilize the bone above and below. What's the bone above? You got it, radius and ulna. And what are the bones below? Your metacarpal bones. So you want to make sure you have a splint that extends from here at least 2/3 of the way up that. Okay? Makes sense. Okay, so once you get those kind of objectives, and then what is CMS? Circulation, motor, sensation. Can they feel it? Can they move it? Does it have capillary refill or a pulse? You want to make sure that whatever splint you put on doesn't make it worse. Okay, if they had a pulse before you put your splint on and now they don't have a pulse, points off. All right, so magazines, folders, that spiral notebook on the desk there. Can I borrow your spiral notebook? This makes an amazing splint. Okay, well, all right, I'm not gonna bend your cardboard, but if I needed to, if I bent that, that actually works really well. Magazines have a ton of tensile strength. It's not gonna bend long ways, and that works really well for forearm splints, wrist splints. If you're a ninja and you wanna get a SAM splint, they are good for wrists and ankles. You can make C-collars out of them. They're malleable aluminum inside padding. They're great. I am the Eastern Michigan Region Advisor for the National Ski Patrol, and I teach their outdoor emergency care class. We use SAM splints, we use cardboard, we use a lot of things. If anyone is a skier or snowboarder and wants to become a ski patroller, talk to me. You get a full MFR license with that, and it's amazing. Legs, again, cardboard, pizza boxes, duct tape. Pillows work really well. If you can kind of wrap a pillow, it gives a lot of support around ankles. Again, the SAM splints, and if you're out in the middle of nowhere, a couple of sticks can even work. Any questions so far? All right. Most of the time, if it's a wrist or clavicle, a magazine and a couple of scarves are enough to get you to the hospital. If it's a leg, even just wrapping some kind of foamy stuff around it and supporting it and using a human crutch gets you there, okay? I don't want you guys calling 911 for every wrist sprain, right? There are ways to get to the hospitals, otherwise you just don't want that limb bouncing in every pothole on the way there. All right, so these are the things. Any question about any of these? Rices? Okay. Moving right along. Burns. Who here has ever burned themselves? Everybody. Okay, so little burns are no big deal, but some burns can be absolutely life-threatening. So burns can be caused by heat, electricity, or chemicals. For heat burns, we're talking about liquids, hot surfaces, steam, and fire. And we grade burns based on the depth. So there's partial thickness burns and full thickness burns. Partial thickness goes through the epidermis and the dermis. Full thickness goes all the way through the dermis, okay? Now the dermis holds your nerve fibers. So if you burn all the way through that, the burn actually won't hurt, okay? And that's where it gets a little confusing. So a first-degree burn looks like a sunburn. Everything is just hyperemic. It's pink, it's warm, it's tender. Second-degree burns, you get blistering because you got damage underneath the epidermis. Okay, so skin is sloughing off or blistering. And third-degree burns, it's either going to look charred or leathery, and it may be insensate. Okay, now you'll have an area of burn, and the outside is first, second, and then third in, so it's kind of a variable level of burn diffusely. But things you want to keep in mind, you want to stop the active burning process. So you want to cool things. Cool running water is your best go-to. You don't want it to be too cold. You do not want to put ice because you don't want to cause a frostbite on top of this. But usually running under cool water for a couple of minutes, 5 to 10, really does help. If there's any clothing or jewelry, especially if it was burned on, try to get whatever you can off. After, burns will swell. So things, if there's rings on hands and there's a burn, get those rings off earlier because you may only have 30 minutes to an hour before things swell, and then we have to start cutting off jewelry. So try to get everything off if you can. They used to teach that butter was a good thing to put on burns. Okay, so go home and ask your parents and grandparents what they were taught, but they used to teach to put butter on burns. Please do not put anything on burns, okay, because it's really hard to wash off. We're a burn center right here, and they have what's called hydrotherapy. So when we have a burn patient with second and third degree burns, we send them up to hydrotherapy. Now I used to think this was this like high-tech, watery bath kind of thing. It's a washcloth and water. Hydrotherapy, they're like just removing dead skin. It's painful and it's not super high tech. So if you put a salve on there, if you put Vaseline or bacitracin or butter, they have to manually remove that. Do you think that hurts? Yes. So don't put anything on burns. Yes?
Can you put it on after you do the cool water treatment?
So it depends on the degree of burn. If it's anything that's going to be going to the hospital, don't, okay? I will tell you, we send people home with bacitracin, which is like Neosporin, if they're small amounts of burns, okay? I have some caveats. The other thing you're gonna do is put a dry dressing over it, so sterile, clean gauze that you'll have in your first aid kits, and loosely bandage. You're not gonna compress burns because they will swell and it'll damage the tissues a little bit.
So what about if it's like a chemical burn? Like, do you want to neutralize that?
Yes, so if it's a powder, dust off as much as you can, and then copious amounts of water, not just the 10 minutes, but copious amounts to neutralize. Okay. If there's any questions, usually if you're in a specialty lab or like you work in the chemistry department and something caught on fire, Each chemical has a special hazmat number, and there's a hazmat book on how to neutralize each one. Water is pretty much safe on all of them. As long as you're not like bathing in phosphorus, you should be okay. All right. These are the ones that absolutely 100% need to come to the hospital regardless. So if you have burns on the hands, feet, face, and groin, and what I'm talking mainly second degree burns. First degree burns, I'm cool with for everything. There's no damage to the skin. But if it's second degree or more, if it's face, hands, feet, or groin, you have to get seen. Mostly because once they swell, you may lead to problems, and when they start healing and scarring, you'll lead to problems. So you need to be in touch with the right people. Burns over a large area of body. What's large? If you think it's large is the correct answer. 10, so each palm is a percentage point. So 10 palms worth is an absolute, okay? So that's kind of like an entire arm. If the entire arm is second degree burns, that's an absolute, okay? And then if there is a house fire or hot gases and there's any difficulty breathing, things that are injured, they swell, right? If your airway starts swelling, is that a problem? Yes, okay. So if you are someone who's coming from any kind of fire and there's soot in the nose, soot in the back of the throat, any hoarse voice, stridor, difficulty breathing, that is an impending airway disaster, and that needs to be seen, okay? All right. Any questions? These are all the things for burns. Cuts. All right, so these are different severities of cuts, lacerations, injuries to the skin. Does the top one need 911 and a tourniquet? No. All right. Everyone take a look at your index fingernail. That is roughly a centimeter across. Okay, we are going to be learning medicine in metrics, so this is a good rule of thumb, okay? So anything about a centimeter or more, okay, so if it's bigger than your thumbnail, usually those are going to need stitches. If you can see inside and see the fat or tissue below it, it's going to need stitches. So anything less than that, wash it with soap and water, bandage it, keep it clean and dry. You don't need to come to the hospital. Get a Band-Aid on it if it's a centimeter or less. If it's larger, if you're seeing the fat underneath, if it's longer than a centimeter, those are usually going to need to be repaired, okay? We will do the cleaning, okay? If it's big and it's going to come to the hospital anyway, don't worry about cleaning it out. Your goal is to stop the bleeding, okay? So if you stick it under the faucet, it's just going to bleed and bleed and bleed and bleed and bleed. So control bleeding first, we'll clean it later. How do you get the bleeding to stop? Usually 2 fingers worth or a palm's worth of pressure on any wound will get the bleeding stopped, okay? You want to hold for 5 minutes, not like, oh, it felt like 5 minutes, but like literal 5 minutes, and make sure it's stopped. And then you can put a dressing on and bring it to the hospital, okay? What if that doesn't work? What if we're talking about this picture that is this massive laceration on the leg? You put some pressure, but there's like legit arterial bleeding coming from this thing. Even when you're holding the gauze, but the gauze is soaking through, what can you do then? 911, you got it. And we can do the principles of stop the bleed. So we are going to do the entire Stop the Bleed course in 2 slides. But basically all of bleeding, if you can apply a dressing, it creates a surface for a clot to form on. Okay, so it will promote the bleeding to stop once a clot is formed. You can elevate the limb because, like I said, if you hold it down here, the gravity is allowing increased blood pressure, so raise it and that can help. Putting pressure is going to help, and then we're going to get to tourniquets and how to create a somewhat improvised tourniquet versus the cat tourniquets. And then last but not least, if you are in a situation and you did not bring your first aid kit with you, half of the population may have some form of sanitary napkin in their purse. So poll the crowd and see if you have a maxi pad or something like that. That is a proper dressing to be used. My 2-year-old nephew has a fantastic picture of him in the back seat with a maxi pad across his forehead where he had a large laceration. And I'm going to make sure I print that for his graduation someday.
Did you know that traumatic injuries are the leading cause of death for people under age 40? And that some of these deaths are preventable? Blood loss is responsible for 35% of pre-hospital deaths. And during mass casualty events such as shootings, 80% of victims are delivered to hospitals by someone other than a trained ambulance crew. Severe bleeding can lead to death in 5 minutes or less. Many people perish before an ambulance can arrive. But it doesn't have to be this way. It's time to stop the bleed. And you can be part of it. Stop the Bleed is a White House initiative that provides people like you with tools they need to take action against life-threatening wounds. In this brief video, we'll show you how to get involved.
Everything was so normal. We were just going about our day, minding our business. But then there was this noise, like a loud pop. People were running and screaming, and then I saw people just lying on the ground, bleeding.
What if this happened to you? Would you know what to do? Here are some initial pointers. Act quickly. What you do in the first few minutes is critical. Evaluate your safety. Is it safe for you to remain where you are? If not, evacuate the area. Tell someone to call 911. Apply pressure. Pressure is what stops bleeding. Let's explore the concept of pressure more. There are two basic kinds of pressure: direct pressure and pressure applied via a tourniquet. There are two main ways to tell whether bleeding is serious enough to require a tourniquet: the volume of blood and the flow. Volume refers to the amount of blood present. Think about a soda can. Cut that amount in half. If that amount of blood is present, then it's serious, life-threatening bleeding. Another warning sign is flow. If the blood is squirting, pooling on the surface, or if it's flowing continuously, then it's serious, life-threatening bleeding. In a real-life scenario, you'd evaluate the volume and flow of blood to help you make decisions.
This person's arm is injured, but it looks like neither the volume nor the flow of blood indicates we need a tourniquet. We need direct pressure instead. You, call 911. This person's injuries are more severe. There's more blood than half a soda can, and it's flowing really fast. That means I need to use a tourniquet to apply pressure.
So you've decided you need a tourniquet. What next? You need to find or make one. Two basic types of tourniquets are out there: commercial and makeshift. Commercial tourniquets are the most effective. If you're in a public facility, you may be able to find one in a bleeding control kit, often found near an AED display. If that's not an option, apply strong pressure with your hands, or use available materials like a t-shirt or towel. Tourniquets are used for severe bleeding on arms and legs, not other parts of the body. The key idea is only the limbs. Apply direct pressure to stop bleeding on other parts of the body. In this video, we'll focus on pressure applied via a commercial tourniquet. Place the tourniquet 2 to 3 inches above the wound. Be careful to place it above the injury, not directly on top of it. Then, simply pull, twist, and clip. Pull the free end of the Velcro strap, thread it through the buckle, and securely fasten it back onto itself. Twist the rod until the bleeding stops, or until you can't twist anymore. Note that this step will be painful for the injured person. Be persistent. Be sure that the bleeding stops. Clip the rod with the small Velcro strap, securing it so that it doesn't untwist. If bleeding continues and you've tightened the tourniquet as much as you can apply a second tourniquet above the first, closer to the torso. Although applying the tourniquet is simple, watch out for these common mistakes. Mistake number 1, not knowing when to apply a tourniquet. Tourniquets aren't appropriate for all injuries. Don't use it for a minor injury or on the trunk of the body. But for life-threatening bleeding on the arms and legs, don't be afraid to use a tourniquet. Mistake number 2, not tightening the tourniquet enough to stop bleeding. Also, remember to keep twisting until bleeding stops. If it doesn't stop, add a second tourniquet closer to the torso, above the first tourniquet. Mistake number 3, placing the tourniquet directly on top of the wound. The tourniquet should go just above the wound, on the side closest to the torso. Mistake number 4, loosening the tourniquet. Leave the tourniquet on until medical professionals arrive. Even if the victim complains of pain, the victim could bleed to death quickly if the tourniquet is removed. Hopefully you'll never have to apply a tourniquet, but knowing how can save a life. Thanks for helping stop the bleed. This message was brought to you by the National Center for Disaster Medicine and Public Health at the Uniformed Services University of the Health Sciences.
So luckily, we've actually covered quite a bit of this lecture already. But this is the standard and official Stop the Bleed course that was put together by the American College of Surgeons Committee on Trauma, the National Association of EMTs, and the Committee of Tactical Combat and Casualty Care. This came about from the conflicts and wars in Afghanistan and Iraq. The soldiers were found to have lives saved if tourniquets were applied. Anyone who is from 1980 as a paramedic or EMT was taught never to use tourniquets. So this information has changed our plan for pre-hospital care, that tourniquets do save lives, and that is the message of today, that tourniquets do save lives, even though the means by which we discovered this information is horrendous and tragic, and no war should continue. These images are actually not interesting at all. They took out all the good photos, so I apologize. So why do we need this training? That the number one cause of preventable death is death after an injury from bleeding. Actually, worldwide, from age 5 to 42, traumatic deaths are the leading cause of world deaths. And most of these are due to bleeding. So if we can stop bleeding that is otherwise preventable, we can save a number of lives. Where can I use this? So everywhere. The 2 times in the field that I put on these, one was a car accident, it was a truck versus a family van, and the dashboard crushed the mom's legs, and she had bilateral open femur fractures, and she was hemorrhaging to death. So we put tourniquets on both of her legs. We started blood infusion right away, and she lived after 12 surgeries to her legs. But she lived. The second was a young man who was angry and punched a window, but instead of going straight in, he hooked it and cut everything, including his radial artery. So those are the 2 recent times that I've had. Chainsaws, it's spring and trees are coming down and people are going to cut up the limbs in their yards. Chainsaws kick back, and if they kick back and hit your femoral artery, that is a bad day. Active shooters are things that we hear about in the news on a very regular basis, unfortunately, and those incidents may also cause extremities to the arms and legs. One thing that's not quite covered, but we're working with Dr. Diebel here to talk with the American College of Surgeons. If you know anyone who is on dialysis, the fistulas and grafts, those are arterial. If those bleed, I've seen the blood fly 10 feet across the room. It's impressive, okay? And they also may need bleeding control for life-threatening bleeding. So our goals of the day, simple. What does life-threatening bleeding look like, and how do we stop it? The way we stop it is easy, 3 things. We're either gonna put pressure, we're gonna pack the wound and put pressure, or we're gonna put on a tourniquet if we have one. We already talked about personal safety. Stop traffic before you go out. If it is an active shooter, make sure that they are not in a place where they can shoot you before you go and get a victim. Keep yourself safe first. And if you have gloves, put them on, know how to take them off appropriately. If you don't, what you can do if you have any breaks in your skin, you think you may have a contamination, is follow the patient to the hospital. They can do source blood testing and see if you need any prophylaxis. The ABCs, we're going to alert 911. We already talked about this at length. You call 911. It's helpful, again, situational awareness to know exactly where you are. It helps EMS get there faster. And for bleeding, step number one is you need to find the source of bleeding, okay? So if someone's wearing 12 layers of clothing, has a big ski jacket on, it may be hard. You may need to remove some clothing to find out where they're bleeding and find out what you're dealing with. What you're looking for after you see the wound is continuous bleeding. So it's just continuous flow of oozing venous blood. Arterial bleeding may be a dangerous sign. Any blood that is pooling on the ground or soaking clothing is a lot of blood. And the next time that you guys have a can of soda, that can is usually about 350 milliliters. Okay, so just under half a liter. Pour it on the ground and see how big the puddle is. Okay, see what does, because trauma surgeons, regular surgeons, OBGYNs, you have to estimate amount of blood loss, right? So getting an idea, soda is a little bit thinner, but if you have like a Jell-O mix, that's even better. So there's your scientific experiments at home the next time you're cooking. People may be bleeding in more than one site, especially if there were car accidents or gun or knife wounds. You might have to check several different places, see where all the bleeding is coming from. And again, clothing may hide bleeding. So find all the spots, and each one of them needs to be addressed. We're going to treat parts of the body a little bit differently. Okay, so you got your limbs, you've got your junctional places, and then you've got your trunk. They skipped the head. The head actually bleeds quite a lot. I think they just didn't want to get into the problem if you had an open depressed skull fracture, putting pressure on the brain, things like that. But pressure works on intact skulls as well. So we're going to start with pressure. Any wound, most wounds, just applying a palm's worth of pressure will stop it. Okay, so usually you want to have some kind of gauze or cloth there. The reason being, this helps clots form. So if you have a scarf, a t-shirt, whatever, and you put that on and then put pressure, it'll help clots form faster. Once you start holding pressure, there's the 5-minute rule, but if it's really a big wound that had life-threatening bleeding, you're gonna keep pressure on there until help arrives, okay? Until EMS gets there and they can apply some kind of a pressure dressing on top of it. This is a very dynamic video on how to stop pressure. I'm being utterly sarcastic, I apologize. But what she's gonna do is take this t-shirt, she's gonna give a couple of layers to it, and then she's gonna apply pressure. She's gonna just like CPR, lock her elbows, lean into it, and hold that until help arrives. That is the entire video, okay. This is actually, of all of the slides I've shown you today, this is my favorite picture out of all of the slides. So you can see in checkbox A, the gauze is making contact with all surfaces of the wound. So when you apply pressure, you're distributing pressure to all sides, and there's something for the tissue to create a clot on everywhere. Section B, you guys learned all the fascial planes, right? So you can hold pressure and that blood can just track wherever it wants to go. You're not actually stopping the bleeding, okay? So if a wound is deep, and what is deep? It depends on if you think it looks deep at the moment. Just picture a chainsaw to the thigh, okay? Sorry, they didn't include the picture for me. I gotta improvise. So if you have a deep, like gaping wound like that, packing is gonna be helpful. So what do you use to pack? Whatever you have. If it's lightly soiled, I don't care if that's all that you have. Okay, we're gonna clean that wound out. They're gonna be on antibiotics anyway. Okay, the goal is to make sure that the bleeding stops. That's objective number one. This is a little bit, again, a very dynamic video. There's a couple of things that I like and a couple of things I don't like. So the first thing is she's using QuikClot. This is gauze that's impregnated with materials that do help clots form faster. What I didn't like is that she didn't look into the wound before she stuck her hand in there. There could be a piece of shrapnel, there could be shards of bone. You really need to be able to protect yourself, and you don't want to be pushing on kind of broken shards of bone. But when you practice, we have the same device. You'll see this is a gaping hole. You can fit quite a bit of material in here, and you want to fill all voids and then apply pressure, okay? So where can you do this maneuver, packing and pressure? Okay, you can do it on the arms and the legs, it works there. You can do it on the neck and the groin, it works really well there, okay, because that's right where the arteries are. But the trunk, if you've got a through and through gunshot wound to the lung, do you think putting pressure on the chest wall does anything to that bleeding lung tissue? No. Okay, same if you have an aortic injury on the belly. If someone has an injury to the chest or belly, they just need to get to the hospital fast. I can't even do anything. They need a trauma surgeon. They need a surgeon to stop that bleeding, okay? So that's kind of the delineation of knowing, especially in a mass casualty situation, who gets priority to get to the hospital first and go to the OR first. But let's talk about tourniquets for a minute. We've talked about pressure and packing. Let's talk about tourniquets. So this again is the new initiative over the last 10 years. This is kind of where all the bang for the buck is. So one thing about, you guys did your anatomy histology class, right? Arteries are very elastic muscle. Okay, so if you completely sever an artery, it doesn't stay right here. It springs northward, right? So anytime you put on a tourniquet, you want to be about a palm's width above the wound, okay? When we teach we teach police, high and tight. You just put it high on the limb and tight, don't worry about it. Doesn't matter if the wound is here, just put it high and tight. That keeps you out of trouble. Obviously, everyone feel your elbow. Can you compress here? No, it's too bony and it bends. That tourniquet's gonna get dislodged. So don't go over elbows or knees. You're gonna tighten this tourniquet, not 1 time, not 2 times, not 12 times. You're gonna tighten it until the bleeding stops. That's your objective. And do not take off a tourniquet. I do not take off tourniquets unless I know I have surgical backup. Because if you take it off and the bleeding starts again, you may not be able to get it controlled next time, okay? These CAT tourniquets in particular were designed for the military that you can put them on yourself. They actually designed a couple of different uniforms that had them built into the uniforms, but they settled on this design. So you can put one on yourself. They can be applied over clothing. But keep in mind, again, big jackets, it makes it more challenging. They do hurt. We have practice ones. I don't want you guys to get to the point that you're in extreme pain, but you'll notice when the blood supply gets cut off, it does feel uncomfortable. And you may, if you put one on and it doesn't work, you might have to go higher and try again with a second tourniquet, okay? With fistulas that are bleeding, you don't want to go over the fistula, but above, and you actually may need one below because of the venous return, okay? This video, not super dynamic, but there's a couple of things I want to point out, because there's one thing I see people do wrong all the time, and it's that they do not lock the windlass. So step number 1, you're going to put it on high. You want to make this part as tight as you can, and you want to adhere as much of this piece of the Velcro all the way around as you can, because if it's just a little bit of Velcro, it could pop off. So Velcro is applied. Now she's going clockwise, right? This wants to unwind counterclockwise. So when she goes to lock it under that C-clamp, she's going to put it counterclockwise to lock it in. That make sense? Okay. Then you make it snag-proof. You can just put that over just to make sure. On a leg, you might not have very much room left over. And then you're going to lock that down with that little piece of Velcro. And then they like to time tourniquets. Now, in real life, I imagine that this whole thing is going to be covered in sticky blood, okay? Ask me how I know, experience, this is going to be a mess. So you might not actually be able to write on there. If you have a Sharpie, go for it. The old trick they used to do is put a T in the time on the forehead, either in marker or in the patient's blood. I know it sounds gross, but if that's all you have, mark. The reason being, again, in a mass casualty situation, if you have 12 patients, and you know that the first 4 have to go to the OR because they have trunk injuries, you need to know how much time you have before you have to get to these extremities, okay? There's 2 different kinds of tourniquets, the CAT tourniquet and the soft T. The CAT is plastic and Velcro, the soft T is no Velcro. It has kind of more of a locking clamp and it's metal. The soft Ts are what the police departments have in Detroit. But the basic principle is the same. Put them on tight, twist, 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 and then lock that twisting piece. What about in kids? You can use tourniquet in kids. The CAT, when you play with it, you'll notice that the base piece of plastic is about 3 to 4 inches. That might be wider than a little kid's arm, right? So you might not be able to actually use that. The nice thing is with kids, you can apply pressure. Pressure almost all of the time does the trick. You can overpower the capillary beds in a kid pretty easy. In terms of deep wounds, you can use packing on children as well. Again, all of these techniques are going to be painful, so talking through with a child in language that they'll understand is important. But again, the objective is to stop life-threatening bleeding. A couple of things that come up quite often. What if you have a knife sticking out of the chest, or you have a stick sticking through the arm? Do you want to take that out? Never, ever, ever, ever. The reason being, on the way out, you may do much more damage, and that may actually be tamponading some of the bleeding, okay? So you might get into a whole big world of hurt if you take that out. Improvised tourniquets, officially never, okay? The reason being, again, if you don't have the supplies on you, you are wasting precious time by going over here to get this piece and going over there to get that piece, and then, oh, I can't remember, where do I tie the knot, how do I tie the knot, and you'll be fumbling around. That time is better served by applying pressure, okay? Now, again, if you want to join the ski patrol and learn how to do this and practice this on a regular basis, if you are like a road warrior and you just want to know how to do this and carry this in your backpack, go for it. Videos abound, okay? But you have to be practiced at it and you have to have the materials with you. Loss of arm or leg. Very, very, very few cases of limbs being lost from use of tourniquets. Anytime you have a hand surgery, they put a tourniquet on you in the OR for 2 to 3 hours. Okay, so this is kind of standard practice. You have to be closer to 6 to 8 hours before you start having some long-term damage. Okay, will these hurt? Yes. The patient I had with bilateral open femur fractures, she was in the state of shock that she was not communicating. The only thing is when we got her oxygenated enough, she would try to move away from the oxygen. And that's as much struggle as she had. She was not complaining of pain. So if you have a patient that's complaining of pain, awesome. They're with it enough to complain of pain, okay? Does that make sense? You can also tell them at that point that the ambulance is coming and the ambulance has fentanyl. And that usually helps, all right?